This is Community Forum, a community service of CAN TV. I'm your host, Juan Carlos Hernandez. Every year, Asian Human Services helps tens of thousands of people from 55 different countries to fully participate, prosper, and thrive in our community. Our guests here are here to talk about their work. Welcome to all of you. I'm glad to have you here.
Thank you.
Let's start off by talking about you specifically and what you do with the organization. Jing, please.
Yeah, I'm Jing Jiang. I'm Director of Community Health Programs with Asian Human Services since 2000. Asian Human Services provide healthcare, education, and employment programs. Under healthcare, we provide mental health, primary care, and community health, mainly prevention and education. Under education, we have adult literacy, which include a daycare.
Oh, daycare too.
Yeah, daycare for children from 2 to kindergarten.
Wow. We'll definitely get into all of those. Let's just hear from Mr. Song, please.
Hi, my name is Song San, and I've been to the agency for over a decade.
A decade?
Yes.
Long time.
Yes, indeed. Myself and Jing together.
Okay.
I oversee programs like disability, and right now we are also, I'm overseeing the ACA part of that as well.
Obamacare.
Obamacare, yes.
Okay. Nargis, please.
Hello, my name is Nargis Saeed. I'm a project coordinator. I just recently started a few months back, and I work with obesity, healthy living, and hepatitis B.
Okay. So, as you were saying, Jing, you have a variety of programs you're working with, and you are the director of
Community health programs.
Tell me about what that means, community health programs, and how they work, and how you serve so many people from so many different countries and all these languages. That must be quite a challenge.
Yeah, it is challenging, but also rewarding too. Community health is more, we're more focused on community. We do a lot of health education outreach, especially in the underserved community, immigrants, refugee community. For example, the program Nargis is running, it's a new initiative that focuses on immigrants, refugee population, and also the underserved community to educate them about healthy living, obesity prevention. A lot of times when people come here first, they have busy schedule, they are not aware about the food, what the choice of food, and
they're not used to, maybe they're not familiar with where to get food they were used to, right?
Right. And a lot of times they eat in the in the
fast food?
Fast food, or how to select food. It's pretty challenging, as you said. So we were very pleased to be able to implement such a program to teach our community about healthy living. And in addition to that's a part of a family and children's health programs. We also provide HIV services, prevention.
Okay.
Yeah,
Do
prevention.
you do testing as well?
Yeah, free anonymous testing. It's a we get a result on the site within 20 minutes.
Within 20 minutes?
Yeah, within 20 minutes, the individual who get tested will get the result. This really, we encourage the members of the community know their HIV status, and more importantly, know how to prevent, reduce risk behaviors, risk factors in the community. We do also case management, housing advocacy, education to patients who are living with HIV.
So all of these resources you provide to people with HIV?
Yeah.
Okay. Case management, what exactly is that for our viewers who might not know what is it, like a court case? I'm sure some people are like, what is a case?
Oh yeah, we case management can range from like a benefit enrollment if
For like health?
individual who tested positive,
Mhm.
we educate our community about the early treatment, the benefits of early treatment, the access to care, how to overcome barriers and stigma. A lot of times people were hide. They were sick, but they do not want their family member and community to know about their condition. That's a tremendous stigma in the community we're serving. So the case management can start from helping them enroll benefit program linked to treatment, more important, medication, and they may need housing services. They may need an array of care, more supportive case management, medical case management, and home services, for people who are really ill and need a home support. So,
It's a very difficult disease or condition to live with, right?
Right. People live longer because of the improvement in medication. Now CDC has been talking about the treatment as prevention too. If people living with HIV receiving treatment, reach the viral suppression, and then that will reduce infection rates too. So we work from both ends about the HIV care and treatment. And in addition to HIV, we also have disability program like Song is overseeing. In the past, we have a developmental disability program. Under ERA funding, like 2010-11, we started the vocational rehabilitation programs trying to help people with high functions to find a job at a competitive wage. We have been very successful. So if people in the community don't have family members living with disabilities, they can contact us, Asian Human Services. We'll be able to serve them.
That's good to know because for many years my mother worked in I guess they called it a rehabilitation center where people with disabilities worked. And their wages were very low, but you're talking that you're helping them actually get competitive wages where they're actually able to make a living. Song, could you please tell us about how that works and how you work with that community, please?
Absolutely. For us to better serve the community, is that all the customers that come to us come through doors first, and then they refer to our agency for job placement. They have to be approved. There's several processes that they have to go through.
Right.
What we do, we refer customers or client to them to get approved. And then once they're approved, the customers or the clients have a choice to choose which agency that they feel comfortable with. So the doors counselor can refer them to the agency of their preference. But we encourage customers whom we refer them to doors to come to us so that we can help them. So once we get all the referrals, our next job is to find the perfect job for them. And of course, disabilities, it has range from mild cognitive to mental, you name it. We get them all.
Really?
Yes.
It's a very wide spectrum.
Yes, yes. So it's challenging, but again rewarding.
What makes it challenging to serve individuals?
The challenging is that when we prep the clients, the customers, for many weeks, and then when the actual interviews start, when they are ready for interview by employers, and they didn't get the job, and that's very difficult, and that's the most challenging for us. but our program is doing very, very well to ahead. We've been very successful at doing this, and right now we need about 100 clients who can fulfill the job order that we have.
Really?
Yes,
That
but
many?
this in the suburban areas. So those who live in the suburban areas who are disabled and qualified for the program, and they have to be developmental disability, cognitive disabilities, learning disabled. Those people can be qualified, and we will put them through, and they have to work full time.
They have to work full time?
Yes, and to receive competitive wages.
So that's 35 hours plus?
It's
40 hours?
40 hours,
Okay.
yes, 40 hours. It ranges, the pay ranges from $8.25 to about $12. Right now they need, as far as we know, they need forklift individuals, they need general office work, and the assembly line, where they have to disassemble computer parts, printer parts.
Right, there's so much of that used equipment that needs to be disposed of properly, right?
Yes, 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 correct. And we need, last time we had a meeting, they said they need about 100 people to cover.
Really?
Yes, to fill the positions.
Now you said that you prepare each person individually, right?
Yes.
Do they have like what they have in education, like an IEP?
Yes, we follow through the guidelines and also what they want, and also we tailor toward their needs.
Right.
Some of our clients, they, we serve the transition clients as well as adults. So it ranges from 17, 18 to beyond 60.
Beyond 60?
So, yes.
Wow.
So
it's a hard to place population.
Right, right.
No, especially when economy was downturn. We have some clients in that age range. We probably successfully placed them.
Wow.
Yeah.
Yes, we have. Yes, we have. Last year we did well, and this year we did well too, but not as perhaps well as last year. But of course, we have a couple more months before the fiscal year come to a close.
Oh, so your fiscal year closes in the spring? Oh, in June. Okay.
End of June.
End of June.
Yes.
Okay. Like many other nonprofits.
That's correct. That's
right.
correct. That's
so
correct.
I'm curious, and I haven't forgotten you. But we'll definitely get to you. I'm curious about one of these older individuals, somebody that's 60 plus or 55 plus, that you've helped, and what kind of job you helped place them in, and how they responded.
It varies from individual to individuals. They all come from various backgrounds. So janitors and office work and telephone interview for the lighthouse.
Okay.
So we have to prep them because some of these adults, they lag behind in terms of technologies or the work today. So we have to prep them. We had to make sure that they are ready for this new so-called workforce.
Right.
It's very difficult. It's very difficult because they always think of, I did well then, and assuming that I do well today. That's not the case. There's a gap between the now and then.
Right.
So we have to replenish whatever, or educate them whatever we have today.
And just one final question before I move on to
Absolutely.
at least for now. How do you prepare those older individuals, or I mean any individual with a disability, to have solid computer skills?
Absolutely. We have luckily a wonderful staff. Jing hired our agency. Jing herself hired beautiful people to help us. They are very, very good at doing what they are doing, and they help us really, really well. They know their task very well, and we prep them all together. We work as a team. We prep them we thrive. I'm going to use the term, we attack the weakness of the individuals to make it look better.
You attack the weakness, but not the person, right?
Not the person. No, absolutely not. Absolutely not.
Mm-hmm.
We fill in all the gaps, the missing link and whatnot, and then when they are ready, we put them out there. And then we monitor them, not just put them out there at the place where they work. We monitor them, follow up with them, how they're doing. You know, are you doing well? Are you doing bad? Are you doing good? Also, the employers, on the other hand, they have to tell us the progress. Is this person doing well? Is this person not doing well? So we need feedbacks from them. And so these communication that going back and forth really help us to gauge in these clients. And also it help us to help other people who come in the next in line, you know, down the pipe. And like I said, we have been doing very successfully with the support of our staff.
It certainly sounds like it, and what I think individuals and our viewers would find most encouraging is that you prepare the person or all these people, and you help them find a job, but then you also do follow-up. You monitor what they're doing, how they're doing. Are those like monthly meetings or something like that?
We would call them sometime. It's dependent on individuals again. Sometimes we call it once a week, sometimes twice a week. It's dependent on individual because they have different functions in terms of function. What you call that, Jing? Their ability to function in a real world. It varies from person to person. Sometimes they have high function, they don't really need you, they just maybe a little encouragement, a phone call, and then off they go. And some people, they need more coaching. Where I can give you an example. A couple of years ago, we had a young fellas who worked at McDonald's, who used to work at McDonald's. We would send our staff, actually with the approval of Jing, you know, send one staff over there to dedicate it to this individual, and eventually he became our poster child. For a while.
Yeah,
yes.
it's really based on individual needs. You know, some people really need just build a confidence, find a job, and they will really thrive. Some people may need more support. Yeah, so longer, it's very individually based, client-centered is our mission statement.
It's a good way of putting it. It's client-centered. So, Nargis, now let's get to what you do with the organization and how you bring individuals in and serve them.
So I work with obesity prevention and hepatitis B. So for both of them, I do workshops to educate people on how to eat better, how to be physically active, and with hepatitis B, just kind of awareness of that there is this real disease out there and can affect you, and what you can do to prevent yourself from being infected. So with like obesity, I run 6-week-long workshops.
How often? Every quarter or?
I usually do like 2 or 3, like for maybe like 2 months, just depending on like maybe more time, just because. So usually I do 2 or 3 at a time, and then along with that I do 1-hour general sessions just to kind of introduce people about what healthy living is, because many people are like, okay, yes, I know I need to live healthy, but then they may not know how exactly to do it.
So in these workshops, they're 6 weeks long. How often per week? Once or twice a week?
Just once a week.
How long?
For an hour.
For an hour. And what happens in the workshops? What, you scold people? Or?
So my workshop is mainly kind of focused for the children. So I talk to the parents, but of course, like anyone can use these tips to live healthier. So it kind of teaches parents on how to have them and their kids eat healthier, move more, less screen time.
What is screen time? Phone, TV, everything?
TV, tablet, phone, video games. It's just been increasing, like what screen time could possibly be. And I've gotten a lot of like questions being like, how can we reduce that? Kids love watching TV. They love being on the iPad. I mean, there are many ways, like bring back some of the old games. Like people used to sit and play board games. People used to, just play games with their toys. But nowadays, I know technology has changed everything, but it's really important that we reduce our screen time, not only for kids, but also for adults.
Right. And talking about screen time, what's the what guidelines would you provide for families as far as or during the workshops? And
2 hours or less per day.
2 hours or less per day.
But this doesn't include, like, for example, if you're doing work and you need to be in front of a laptop, or if you're at school and you need to be in front of a laptop. This is like recreational use, so like watching watching TV or games in your free time.
What's the average number of hours a person or a child, that's talking about children, spend in front of a screen? Do you know that number?
I don't know the exact number, but I can tell you it's very high. Like, I have seen kids who wake up and first thing they do is they run for like the iPad, or they run to watch TV, or like they're just continuously, even if they have phones, even at school, they may just somehow be on their phone all the time. So it's actually been increasing, where to the point, people just, it's kind of an extension of themselves now. Some kind of technology, has become an extension of themselves.
Yeah. So you talk about reducing screen time. What else do you cover in these healthy living workshops?
So 3 main topics: energy in, which is eating healthier; energy out, how much you're moving, how much you're actually doing exercise and being physically active; and reducing screen time. So those are 3 main things I cover in the 6 weeks.
Now, you, as we've mentioned a few times, you work with individuals with you could work with a group where nobody speaks English. Is that a fact?
Yes, I have worked with some people who don't speak English. Like the people I work with, like their level ranges. Like, some may be like very well off in how they speak English, or they may need some more help. So I mean, like, the good part is that they help each other also, and I do my best to like translate. If like it's a group, I can speak to like another language. So I do my best to kind of help them, and I try to use more diagrams, because it'll be easier to understand rather than just putting bunches of words on the board.
Okay, so it's energy in, energy out, and I'm still curious about the energy in, though, because all these people come from all these different countries, and as she said, you help them learn how to navigate, I guess, in some ways, a new world for them, and not just fast food.
Yes.
Do you go shopping, or do you make shopping trips with individuals or groups as well? Or
I haven't done that yet, but what I do is like, if from whatever specific culture they're from, find meals and give them a healthier option for what they can do to eat a healthier meal. Because I mean, obviously you can't be like, okay, you can't eat your cultural, your ethnic food anymore, but what you can do is eat like healthier option for that.
Did you know, interesting, now the CDC was talking about the food label, how you choose when you go to grocery store, pick up food, read the food labels, reduce intake of saturated fat or fat in general, and salt too, sodium. Now they change. In the future, it might implement because at first, it's very even challenging to teach our community about reading the food label when you buy a ramen noodle or.
I've seen many people eat macaroni and cheese, actually.
Macaroni cheese. No
matter what ethnic background they're from. Macaroni and cheese is a favorite.
It's so simple.
It is.
Right, but now they put the percentage of the nutrients at the front and put a label next. So people will probably more eye-catching than you read the cholesterol, sodium, fat on the left. They put percentage on the left. So now how you watch your intake of different nutrients. I try to have a healthy diet, maintain healthy diet. Now in Chicago, typically in this weather, long winter, where your energy out. it's important too.
Well, shoveling, I don't know.
That is a really good way, yeah.
Yeah.
Shoveling.
Yeah,
Yeah,
definitely.
you should really 30 minutes exercise at least 3 times a week.
Right.
Those that we
For
needed
adults.
to let the community know, because we know in certain ethnic group the childhood obesity is very high, even in adults, because how to know here a lot of times how you individual relate to the food,
Right.
because their past experience.
Right, definitely. This is all great information, and I'm glad you've shared some of it. And certainly, we send people through to your website as well. But we're out of time today. Thank you so much for sharing what you have, and thank you for working in the community.
Thank you
Thank
for
you.
having us.
Yes, thank you.
Thank you.
Community Forum is a community service of CAN TV. If your nonprofit would like to work with CAN TV, call 312-738-1400 and ask for nonprofit services. Tune into Community Forum for local issues and concerns every Saturday at 7:30 p.m. on CAN TV 21. I'm Juan Carlos Hernandez. Thank you for joining us.